The patient is a 45-year-old male who is diagnosed with type 2 diabetes, hypertension, and high low-density lipoproteins after a physical examination for the first time in multiple years. His main diagnosis is high low-density lipoproteins, so basically just bad cholesterol. The patient was unaware of the poor condition of his health. He was under extreme stress due to a daughter who had cancer, as well as the 2008 recession. He was under a lot of financial stress, as well as the hospital bills that caused even further financial stress. His diet was poor, as he would eat fast food at least once a day and would usually drink a large sweet tea. He lived a sedentary lifestyle as he had an office job and did not care for exercise in general, especially for their circumstances. He was considered obese at the time with a BMI of 33. Anything over 30 is considered obese. He also had a very inconsistent pattern of sleeping due to his daughter being in the hospital for years. He denied smoking but had a history of occasionally drinking alcohol about once a week. He stated that since his daughter's diagnosis of cancer 2 years prior, he did not really drink at all anymore. His father passed away from a heart attack at 65 years old, and he also had a history of type 2 diabetes. So the patient was prescribed simvastatin for his cholesterol, which is used to target cholesterol production and lower its concentrations. It also helps to manage abnormal lipid levels and inhibit endogenous production of cholesterol in the liver, which helps to reduce the risk of cardiovascular disease. There are also many other medications under the statin class, such as atorvastatin, pravastatin, and lovastatin. Atorvastatin is a more potent statin and is typically used when simvastatin is ineffectively controlling low-density lipoprotein cholesterol. Pravastatin is not as strong as other statin medications, but it does have fewer side effects. It is mainly broken down in the stomach rather than the liver, so this medication is likely given to those with liver issues, which the patient did not have. Lastly, lovastatin, which is chemically similar to simvastatin, but it is less effective at lowering targeted bloodstream cholesterol levels. This patient takes 40 milligrams of simvastatin once daily in the evening and has effectively managed his low-density lipoproteins for the past 10 years. Some common adverse effects include headaches, myalgia, abdominal pain, gastritis, constipation, upper respiratory infections, elevated AST or ALT, and impaired serum glucose control. However, this patient currently takes 10 different prescribed medications, so it is hard to tell if any adverse reactions are caused by simvastatin or his other drugs. Thank you.